As we continue our discussion on breast cancer in Canada, it's important to address the broader systemic issues in our healthcare system and what changes could make a significant difference in the diagnosis and treatment process. So, with that, Dr. Gordon, could you explain how the recommended protocols, like using mammograms as a primary diagnostic tool, are established?
We have 10 provinces and 3 territories in Canada. 12 of them have screening mammography programs. That's where everything starts. And then after that, it's a bit of a mishmash. Each province decides when women can start having screening and how often they can come. And it varies from province to province. Wonderful resource for your listeners is
Mhm.
a website called densebreastscanada.ca.
Okay.
And there's another one called mybreastscreening.ca, and women can log in, they can click on their province, and they can find out what's available in their province. Now it's really hard to keep those up to date because we're making so much wonderful progress thanks to patient advocates that things are changing all the time.
Good.
So when I started out advocating, there were only 4 provinces that let women start having mammograms at 40. And I think we're up to 11 and moving. For example, in Edmonton, Alberta and Northwest Territories, they can start at 45, but they're trying to lower it to 40. So stay tuned. Some provinces let women who have dense breasts have their mammogram every year, which is a good idea. When you don't see a cancer on the mammogram, and if it's not found with ultrasound or another test, it's usually found when a woman notices it herself
Right.
on breast exam, whether it's deliberate breast exam or whether she just realized when she was showering, oh, there's something there. When those cancers are diagnosed, we call them interval cancers because they were diagnosed in the interval between planned screening mammograms.
Mm.
Interval cancers are bad actors. They tend to be larger
Mm.
than detected cancers. They're more often lymph node positive, and women who have an interval cancer have a poorer prognosis than women who have a screen detected cancer. And there's research done in Canada showing that if women with dense breasts have an annual mammogram, even though the mammograms are less perfect than even other women, that we get a lower interval cancer rate. And that's really valuable. So some provinces let women come every year if they have category D. Every single province lets a woman come annually if she has a mother or sister with breast cancer. We know that those women are at higher risk.
Okay.
But what a lot of women don't realize, and this is really important for your viewers and listeners to learn, 85% of women who get breast cancer have no family history.
That's
I have
huge. That's
nothing. Oh,
huge.
I don't need to have a mammogram because there's nobody in my family with breast cancer. Wrong. All women need to have a mammogram, and we have data showing that you save the most lives, you find the most cancers early if women have annual mammograms from 40 all the way up to 79.
Mm.
Most provinces don't let women come until 79. Some provinces do, British Columbia and a few others do. Um, some require that a woman has a requisition from her doctor after age 74. But it's definitely worth doing because some women say, oh, I don't have to worry about breast cancer. I'm 70 now. I'm not going to get it if I haven't got it already. That's also wrong. A woman's risk of breast cancer keeps climbing the older she gets. If you don't die from
Wow.
heart disease, lung cancer, your breast cancer risk keeps going up.
It's
So
not very encouraging.
well, the bottom line is we know how to find cancers early.
Right.
Women should have a mammogram. If they have dense breasts, they should have supplemental screening, either with ultrasound or MRI or contrast enhanced mammogram, depending on where they live. And women can also do something. Well, first of all, nobody likes to hear this. There
About
are
15 seconds left. I'll have to stop you in a second.
things to reduce a risk. Women should know that if they have a healthy lifestyle, including minimizing alcohol intake and exercising regularly and maintaining a healthy body weight, that the risk of getting breast cancer goes down.
We hope you learned something about breast cancer detection and diagnosis today. And if you're currently facing a critical diagnosis, or still trying to get one, never hesitate to advocate for your own health. We appreciate you joining us on A Healthy Dose. Until next time, take care and stay proactive about your health.